We have a serious lack of provider education when it comes to menopause management, and this is problematic for a variety of reasons. One reason is simply that women are just not being managed as optimally as they could be, but also it can be really confusing and frustrating when you're talking to different providers and they're giving you different information and you're just not sure who to trust and what guidelines to follow. And this is true regardless of the provider type. I've seen misinformation being spread by primary care providers, gynecologists, cardiologists, endocrinologists, and also naturopathic doctors, which is my provider type. So it is not a provider type issue, it's an education issue. We are not taught enough during our education program, regardless of what your provider type is. So this means that whatever provider you're seeing needs to be seeking out education outside of whatever they learned in school. That means that continuing education that they are getting involved in each year or at least every other year needs to have some component of menopause management, and the more the better. And so there are a variety of different places they can get that information that are reliable sources. There's not just one. The main goal is just that they are continuing to seek out that education, especially as things are changing so rapidly. The information is changing so much because we're having a lot of new research coming out, new evaluation of old research, a lot of perpetuated myths that have been ingrained in our medical community are being disproven. And that doesn't mean that those providers were wrong. We just were misinformed and perpetuating things that weren't totally true. So we have to be learning the new things and being updated on all that information to make sure we're giving women the safest and most comprehensive management we can for menopause therapy. So if you find you've heard several different opinions on whether something's safe for you, what the ideal form is for you to use or take, just go back and at least reference the Menopause Society. They have a guidelines that you can download for free on their website, or find a provider that is certified through the Menopause Society, which is one of the things that I'm working on, primarily just so that you know what standardized guidelines that I'm following so that you can trust my judgment, especially if you go to one of the providers I've sent you to for a legitimate reason. It could even be a gynecologist that I've sent to you for further evaluation for an issue, and then they're saying, oh, the hormone replacement therapy you're on isn't appropriate, it isn't safe. For example, I've heard people say oral micronized progesterone is not safe. I've heard other patients come back from a provider saying the estrogen you're using that I know is a low dose topical estrogen isn't safe and is actually causing this risk of endometrial cancer because it's not balanced with progesterone, when because I'm certified and educated, I know that what I'm giving them is actually really safe and doesn't need to be balanced with progesterone. But how would you know that? You don't have that medical education, and you shouldn't have to. So I don't have an easy solution for you. These are just a couple of ideas in making sure that your providers are as educated as they can be and they're getting their education from a reliable source. So the Menopause Society is just one, but as long as you're finding that you're getting some pretty similar or consistent recommendations and you feel like you're on the right track, and most importantly, that you're feeling better. So those are some tips for you.